Welcome to Ensure Health podcast produced by SD Gupta School of Public Health, IIHMR University. This podcast is a product of TIPH, this is Public Health, a global grant funded by Global Network for Academics in Public Health, committed to raise awareness about public health around the world. We are conducting a series of dialogue and conversation with the public health enthusiasts, experienced people who have created an impact in the world. Today, we are privileged to have Shri Gajanan Patil ji with us. I am your host, Piyusha Majumdar. So, talking about Dr. Gajanan Patil, he's an IAS officer, he's the CEO of Pune Zilla Parishad. He's a dynamic administrator known for his commitment to rural development, innovation, and citizen-centric governance and local self-governance in Pune district. His leadership continues to inspire impactful changes at the grassroots level. So, sir, we know that today you are in the forefront of local innovation in digitizing Ashadhi Wari, in which digital innovation of all the essential services has been done. And we would like to know how this innovation worked for the Varkaris. So talking about Ashadhi Wari, it's essentially the moving city of over 1 million people walking hundreds of kilometers. So what, according to you, have been the greatest public health and epidemiological challenge of managing health security at this large scale?
Thank you, Ayusha ji, for taking this important issue for the podcast. As we all know, Ashadhi Wari starts from Alandi and Dehu from Pune, and pilgrims, whom we call as Varkaris, they travel to Pandharpur, around 300 kilometers of distance. Around 15 to 20 lakh people, they travel, they walk, in fact, the entire stretch. So it has been a privilege for me to work on such a project for consecutively for 2 years. So there are a lot of challenges, basically, especially with regards to health management, sanitation, to handle such a huge population walking from Dehu Alandi to Pandharpur. So this normally comes in rainy season. Initially, there was no rainfall, so heat was there. Then came heavy rainfall, kind of cloud blasting, where there were floods. So it is basically managing communicable diseases, food care, child and mother and elderly people, and sanitation and cleaning of all the roads and villages after the Wari moves on to Pandharpur. So these are basic challenges which we are facing, in fact, in the managing the Ashadhi Wari.
Essentially, I mean, these are really a challenge because here we are involved with lakhs and lakhs of people. So, talking about more about the health camps and mobile ambulances, I'm sure that it have always been a part of this worry. So, what was the exact tipping point that made the administration realize that paper-based tracking and the standard logistics were no longer enough? And now this is a time for shift towards digital intervention.
So basically, to manage such a huge crowd of around 20 lakh people walking towards Pandharpur is a basic challenge. So our traditional method of maintaining all the records on paper, that doesn't work in such a huge crowd in a small period. So we managed to manage all this through digital interventions, where we developed a platform where we mapped all our health centers, camps, primary health centers, sub centers, rural hospitals, toilet blocks, temporary toilet blocks, permanent toilet blocks, everything uh, is mapped on the digital platform, where we mentioned the locations of the ambulances, the police camps and police stations along the route. So that's how we could manage the uh, uh, entire system. Then we basically, there are some delays in the ambulances dispatches where some emergency happens. So this our app actually maps the ambulances, which reduces the response time for the emergency healthcare system.
Okay, I mean it's quite interesting that you have a app and that will that is helping. So how does digitalizing this health services change the way you approach spatial planning, route mapping, resource allocation across different districts like Pune, Satara, Solapur?
So this is basically integration for all the three districts. Like Wari moves, Gnaneshwar Mauli is Wari moves from Pune, Satara, and Sholapur district. And Sant Tukaram Maharaj Palki, it moves from Pune to Solapur district. So this digital intervention basically integrates the monitoring system for all the three districts. So it gives enables a district level platform and a state level platform where we can monitor the usage of our services, basically food services, primary health centers, sanitation services, toilet blocks, wherever. And then the most important is the water supply system, for mainly for drinking water and cleaning water. So all these systems could be tracked through the app, and it integrates. It becomes easier for all the administration of all the three districts to monitor these kind of services very effectively.
Very true. So, sir, we know that these pilgrimage they often pass through some remote areas, rural areas, in which you don't get the mobile network. The places are highly unstable. So, how does this app that you have made works for them?
So as we know, the as the Palki moves from Pune to Pandharpur, there are a lot of network issues, mainly because of overcrowding of the locations. So this our system is basically lightweight. It is made on a lightweight design where very low bandwidth also it operates. Secondly, it can be operated on offline mode where the preloaded maps could be it will guide the warkaris or pilgrims to locate the uh, ambulances or the health services or sanitation and water services. Thirdly, there is a periodic sync. It has a facility of periodic syncing where immediately once it comes into the network, it uploads all the syncs all the maps and the locations of the um, uh,
Okay, yeah, I mean quite usable for those areas where we found very less network.
and basically you must be aware that it all the warkaris, they most of these pilgrims are from rural area, so they doesn't have that much of acquaintance of downloading any app, or they are not used to such kind of digital network. So we have made it very simple. It's QR code based. So once you scan the QR, it gives you all the information available on the platform.
So it's a very, very interesting thing to know, sir. And we would like to know because that Wari crosses multiple district boundaries. We have three districts you're talking about. We have Pune, we have Satara, we have Sholapur. How does the back end of this Wari app that unify, a separate district administrative structure into a single real-time health command dashboard. How does all these things works for you?
So basically, this is a very lightweight designed app, which the backend works as a central dashboard, and it gives the entire tracking of our facilities, where the crowd is more, or where emergency services are required, or um, a, this digital analysis and tracking, it gives us basically for administration the inputs to mobilize our resources. Basically, if there are water tankers required, ambulances required, all these things could be monitored and tracked through the central dashboard. Backend system is very important, which because it gives inputs to all the administration working on the Wari facilities.
Right. So if I talk about a user's perspective, okay, a user who has used, this app, how does it help a fatigued or maybe injured Barkari to find a foot care center or a primary care physician or maybe a ambulance in a crowded place of hundred of thousands? How does that work?
So basically, through this QR code scanning, it gives you the nearest location of the food care system, ambulance, police station, our health camp, primary health center, sub center, or the ICU facility available nearest to it. Secondly, it navigates you to the nearest facility. So you can immediately reach to the facility which is available near, because there is huge crowd walking. So it is very difficult to ask anyone or to locate the system. So it helps to navigate the available facility. Third, actually, it reduces the time for asking or locating the health facility and sanitation facility. So basically, all our facilities, food care unit may be there, or ambulances, or the health camp, or drinking water facilities. It could be tracked, navigated, and reached by the Varkaris or the pilgrims immediately.
Does it also have any helpline number or something like that?
Yeah, it actually has the helpline number, because we at a district level, we have a 24 by 7 war room available for the Palki. So it immediately diverts their call to the helpline number. So then the helpline number, it diverts the call. If it is health related thing, to the health facility. If it is something related with police, it diverts the call to the police helpline.
So, sir, as we were talking about Ashadhi Wari, the listeners would be really interested in knowing that how many users are there for this app, for the app that is named as Health Digital Waris.
As I mentioned earlier, I would like to put some figures. So around 15 to 20 lakh people traveling, walking in the Wari. The OPD in all our health facilities was around 2.5 lakh people. So that's a huge number. We had deployed around 3,000 medical, paramedical staff, sanitary staff. All infrastructure was put on place. Around 78 ambulances were there, 320 water tankers were provided. All these facilities was given. To add to this, the digital initiative, Tech Digital Wari app, was used by around 60,000 people this year. And the specialty of this app is it's not required to be downloaded. You can go directly through the QR code scanning. So probably since this was first year, next year we will have huge number of people using this app.
Right. So, sir, so what is your ultimate dream? Because I think this is your initiative and your team's initiative. So, what is your ultimate dream for a fully digitalized smart Wari 5 years from now?
See, I have been working on Ashadhi Wari for last 2 years. In fact, this year I walked a bigger stretch along with the pilgrims. I could speak with the pilgrims. I could understand their issues. I asked them from where they are coming. Surprisingly, the newer generation, especially from the IT community, they are also they also take part in Wari, and they walk along, especially from Pune to southward. And there's a stretch of around 30 kilometers. Most of the I, ITNs, they also enjoy walking in the Wari. So basically, when I spoke with these Gen Zs, they suggested us, and then we have planned for fully digital, smart, and resilient Wari in next 5 years. So uh, in future some years we'll make it AI based Wari, where we can, based on AI technology, we can assess the medical requirement. We'll analyze what kind of facility is required at which area, where the crowd is more or where there is a less crowd. Immediately we can move our facilities to the required locations. So basically we will use AI based technologies to give facility to pilgrims, especially health requirements. So we can assess what kind of epidemics, or maybe what kind of diseases are prevalent in which area. Based on the last year's experience, then we can plan for the next year. So for next 3-4 years, we are fully prepared for AI based, fully digital, and smart resilient Wari.
Wonderful. That's great to know that. And thank you so much for talking to us and uh, telling us about the innovative app which is using in Maharashtra.
Thank you.
Thank you. Thank you so much, sir, for
Thank you.
telling this incredible figures to us. And it's fascinating to know that people know about this app and they are using this app. Thank you so much.
Thank you.
तुझ्या दर्शनाची आस कधी थांबायची नाही. उभ्या जन्मात विठ्ठला